Ever wondered why your body reacts oddly to certain foods or changes in the environment? It's time to unravel the mystery of allergies. Today, we'll explore the A to Z of allergies, emphasizing how they influence the lives of our elderly loved ones. From comprehending what allergies are, recognizing their symptoms, to discussing treatment avenues and preventive steps, we've got it all covered. Stick around to get a comprehensive understanding of allergies. So, what exactly are allergies? Now that's a question worth pondering. Simply put, allergies are your immune system's overzealous responses to substances that are usually harmless. Picture this. You're enjoying a sunny day when suddenly you sneeze. What's happening here? It's just your immune system mistaking something innocent, like pollen, for an invader and going into defense mode. This reaction triggers symptoms, which can range from mild inconveniences like a runny nose to severe conditions like anaphylaxis, a potentially life-threatening reaction that needs immediate medical attention. Now you might be wondering, how common are allergies? Well, they're more common than you'd think. Allergies don't discriminate. They can affect anyone, at any age and in any part of the world. The severity and type of allergic reactions can vary greatly from person to person, and even from one reaction to the next in the same individual. Remember, allergies are common. You are not alone in this. Allergies come in many forms, each with its own set of symptoms. Let's delve into the different types and how they might manifest. First off, we have food allergies, a reaction to certain foods like peanuts, shellfish, or dairy. Symptoms can include hives, swelling of the lips, face, or throat, and in severe cases, difficulty breathing. For some, even a minuscule amount of the offending food can trigger a reaction. Then there are seasonal allergies, often caused by pollen from trees, grass, or weeds. These are the culprits behind hay fever, with symptoms such as sneezing, runny or blocked nose, itchy or watering eyes, and even tiredness. Next up, skin allergies. These can be triggered by a variety of factors, from certain fabrics to beauty products. Symptoms can range from a simple rash to severe itching and blistering, known as contact dermatitis. Insect sting allergies are another type to keep an eye out for. A sting from a bee, wasp, or hornet can cause swelling, redness, and pain. In some cases, people may experience anaphylaxis, a severe and potentially life-threatening reaction. Lastly, let's talk about drug allergies. These can occur in response to any medication, but are most commonly seen with antibiotics. Symptoms can vary widely from a rash and fever to difficulty breathing and anaphylaxis. Speaking of anaphylaxis, this is a severe allergic reaction that requires immediate medical attention. Symptoms come on rapidly and may include a rapid heartbeat, sudden difficulty breathing, dizziness, and loss of consciousness. Without immediate treatment, it can be fatal. It's critical to remember that allergies can range from mild to severe. Some people may only experience minor discomfort, while others may have life-threatening reactions. The key is knowing your own body and recognizing the signs of an allergic reaction. Knowing these symptoms can save a life, especially in severe cases like anaphylaxis. Now that we know about the types and symptoms of allergies, let's explore what causes them. Allergies are triggered by substances known as allergens, which are generally harmless but can cause an overreaction in susceptible individuals. These allergens can be found in a variety of sources. Common allergens include animal products such as pet dander or insect stings. Certain foods like peanuts, shellfish, or dairy can also trigger allergic reactions. Environmental factors like pollen from trees and flowers or mold spores are another major source of allergens. Even certain medications can act as allergens for some individuals. It's important to note that not everyone who is exposed to these allergens will develop allergies. This is where genetics come into play. If your parents or siblings have allergies, you're more likely to develop them too. This doesn't mean you'll have the same allergies, but the predisposition to have an overly reactive immune system can be inherited. Additionally, factors such as age, sex, and exposure to certain environmental conditions can influence your risk of developing allergies. For example, children and the elderly who have weaker immune systems are more susceptible. But what does this mean for you? Well, if you're aware of these common allergens and risk factors, you can take steps to avoid exposure and reduce your risk of triggering an allergic reaction. Remember, knowledge is power when it comes to managing your health. Understanding your triggers is the first step in managing your allergies. So, you've recognized your allergy triggers. What's next? Well, let's dive into the realm of treatment options. One of the first lines of defense against allergies is medication. Antihistamines are often the go-to choice. They work by blocking histamines, the chemicals your body produces during an allergic reaction that cause symptoms like itching, sneezing, and inflammation. Over-the-counter antihistamines are readily available, but remember, they may cause drowsiness, so be sure to read the label carefully. Then we have corticosteroids, which are typically prescribed for more persistent or severe allergies. These drugs reduce inflammation and can be administered in various forms such as nasal sprays, pills, or creams. For those with life-threatening allergies, there's emergency epinephrine. This is a medication that quickly reduces severe allergic symptoms. It's typically delivered via an auto-injector, and it's crucial to have it on hand if you're at risk of anaphylaxis. Another treatment option is immunotherapy. This involves exposing the body to small amounts of the allergen over time, with the aim of reducing sensitivity. It's a bit like training your immune system to be less reactive to the allergen. This treatment is often used for allergies that don't respond well to medication, or when avoiding the allergen is difficult, and then there are natural remedies and supplements, which some people find helpful. These may include herbs, vitamins, or other natural substances. However, it's vital to consult healthcare professionals before trying new treatments. What works for one person may not work for another, and some natural remedies can interact negatively with other medications or conditions. Lastly, let's not forget the importance of managing exposure to allergens. This might mean keeping your home dust-free, avoiding certain foods, or staying indoors on high pollen count days. It's all about finding what works best for you. In the end, treating allergies is about improving your quality of life. It's about finding relief from symptoms and reducing the risk of severe reactions. Remember, the right treatment can make a world of difference. Prevention is better than cure, especially when it comes to allergies. Diagnosing allergies isn't a guessing game. It involves physical exams, blood tests, and skin tests carried out by healthcare professionals. They look for specific antibodies in your blood, or observe your skin's reaction to various allergens. This helps to pinpoint exactly what you're allergic to. But what's even more crucial than diagnosing allergies? Preventing them. Prevention starts with identifying your triggers. Once you know what you're allergic to, you can take steps to avoid those allergens. This might mean staying indoors on high pollen days, avoiding certain foods, or keeping your home dust-free. Reading labels is also key. Many food allergies can be managed by carefully checking food labels for allergens. And if you're prone to severe allergic reactions, regular allergy testing could be a lifesaver. Remember, knowledge is power. The more you know about your allergies, the better you can prevent reactions. Stay proactive and prevent allergic reactions before they happen. Allergies can complicate other health conditions, so it's essential to be aware. When allergies are left untreated, they can lead to more severe health complications. For instance, an extreme allergic reaction, known as anaphylaxis, is a medical emergency that requires immediate attention. Allergies can also worsen other health conditions. Asthma, a condition affecting the airways, can be triggered or exacerbated by allergies. When allergens enter the respiratory system, they can cause the airways to narrow and produce excess mucus, leading to asthma symptoms like shortness of breath, wheezing, and coughing. It's also important to differentiate between allergies, colds, and sinus infections. While they may share similar symptoms such as runny nose and congestion, their causes and treatments are different. Allergies are a reaction to a harmless substance, while colds and sinus infections are caused by viruses or bacteria. Awareness of these complications can help manage allergies more effectively. Living with allergies can be challenging, but it's not impossible. Navigating daily life involves making simple adjustments, like avoiding known allergens and keeping your environment clean. Adherence to prescribed medications is paramount, and don't shy away from seeking support from healthcare professionals. They can provide valuable guidance and reassurance. Remember, allergies may be a part of your life, but they don't define it. Take control of your allergies and live life to the fullest. We've covered a lot today about allergies. Your support means a lot to us, so don't forget to like, subscribe, and ring that notification bell for more updates. Share your experiences and questions below. Remember, understanding is the first step in managing your allergies. Stay informed and stay healthy.